I want to talk a little bit about COVID and the economy. We've had entire industries that have dried up. Some have all but shut down. Some have shut down completely. We've got businesses, entrepreneurs having to close up shop. And with all of that, there's an increase in anxiety and distress, in some cases, low self-esteem. And that's leading to higher rates of substance use. And you mentioned suicide ideation as well, Sheree. Polling data shows that more than half of the people who've lost their jobs reported negative mental health impacts from worry and stress over coronavirus. Lower income people are disproportionately affected there. And unfortunately, and still in this country, Black and brown folks make less money than our white counterparts. So, yet again, is this something else we need to be thinking about as we're thinking about the mental health impacts of a virus that is disproportionately affecting Black and brown people in so many ways? Kristen, I'll ask you to take it first.
Sure. Yes. The interesting thing about what you're talking about in terms of loss of jobs and the domino effect that happens once an individual loses their financial stability. Once that component occurs, where someone loses their job and they're unemployed, there's several other domino effects, right? So once you lose your job, majority of individuals have health coverage attached to that. And then now individuals are looking at a lack of health coverage. And without a health coverage in this climate right now, it can be worrisome. So you have that component that then leads into the mental health components, where the stress and the worry and anxiety comes in. One thing that I'm really seeing with individuals and patients is that COVID-19 for people in recovery, for example, there's a decrease in narcotic treatment facilities. So part of being in a non-narcotic treatment program is the ability to go to an actual physical clinic and receive your dosage through only through certain clinics, which is a very highly regulated program. So individuals are not being able to receive their medication for their addictions and less access to substance use disorder services, such as group treatment and one-on-one therapy. So individuals who are in an NA program or AA program, they're relying on that social connection of meeting with those other 12 individuals or 11 individuals in that group setting. And now that's being taken away and they're being isolated in the home. So more isolation has exacerbated addiction and habits in that sense. So when you look back at our discussion prior, actually, about disparities of families of color and race not being able to work from home, I think it's just a compounding effect of once someone loses their job and that financial stability and that medical stability, it kind of rolls into other mental health conditions.
I think you're probably right. Sheree, do you have anything that you'd like to add to that one?
I would say the other thing that we have to realize, back to the beginning of our talk tonight, is looking at the social determinants of health, and it's why it's so important for us to be equally invested in those things as we are as healthcare professionals, because those things do impact outcomes as well as patients presenting to healthcare institutions or to other healthcare professionals for help. So it's really important, and an upstream solution to helping folks during this time is really to look at those things that, like, the joblessness and the trickle down effect of that, are the loss of health coverage or insurance. So one of the things that we really have to hold our elected officials accountable for is working on those social determinants of health, because that is healthcare. Healthcare is not just what we're doing when you come in to see a healthcare professional. It's really making sure our communities are healthy so that we can have access to the things that we need to be able to not only survive, but to thrive.
We've talked about so much great information, guys. I want to be respectful of your time, but I got a few more questions. You have time for me?
Yeah.
Yes, most definitely.
Let's talk about COVID prevention. And at one point, COVID prevention was going to be a whole separate conversation. I was going to do something
Mhm.
called the mental health fallout from COVID prevention as a whole StreamYard, a whole session. But let's include it here. We know about three pillars. We can get by on hand washing. That's pretty simple, and I don't think that's too many issues. But I want to focus here on social distancing. We know how important it is for us to remain distant from people. You know, the number I think is fairly arbitrary. Is it 6 feet, 8 feet, 10 feet, whatever? We know we need to stay distant from people. We need to avoid large gatherings. We need to avoid large crowds. For an extrovert like me, right up front, that caused a little anxiety. I get all of my energy from social interactions. So the minute I heard you couldn't go out, you can't go to the movies, a lot of the reason I went to the movies was because of the crowd. I didn't pay $15 to see a movie because I felt like it. That crowd, that energy, I got a lot of positive feedback for it, helped my mental health. So I was a little concerned about that. Talk about the fallout from doing what we need to do to stay healthy. We know what we got to do, but something like social distancing might cause a little stress. For Black men, wearing a mask might cause a little
Mhm.
stress. It causes me a little stress. I, as a Black man, am not going to walk into a bank. I haven't been in a bank since March because I am not going to walk in a bank like this. I look like a wanted poster. So, talk about staying healthy and making the choices that we have to make and what the mental health fallout can be from that so that we can brace ourselves for it and get past it and do what we need to do to stay healthy.
You want me to go
Yeah,
on the
you
next?
Yeah,
can go
take it.
first.
Yeah. Yeah,
Okay,
take it,
okay.
Kristen. Yeah.
Mhm.
Sure. So there, for individuals that I work with that may be struggling with agoraphobia or anxiety, generalized anxiety disorder, I provide a few tips to help them, or even extroverts, individuals who are extremely extroverted, as you were saying. I provide a few tips for them to really to stay healthy during this time. And one is the structuring of your days. I think that is really important. Structuring your days and developing a sense of normality really does help feelings of hopelessness, and really setting that routine and follow as best you can, whether that's waking up, taking a shower, exercising, having that study time, and even putting on work clothes. You know, that really shows to boost your self-esteem and your appearance as well. And also planning out your cheat meals. So, for example, it's really been a struggle for individuals to stay on a regimen plan in terms of how they're eating. Individuals are ordering out more, they're ordering DoorDash more than they would. So really planning those meals out, and also engaging in those hobbies, and trying to space out your activities to consume your day. That's really been helpful for a lot of my clients. Really spreading out that time period throughout the day to make sure they have something going on throughout that period, and also keeping the social contact, doing really more than just um, um, meeting with your family on Skype, but really having those virtual toasts or celebratory events. So really it takes being creative in a sense. And I can't express more self-care, self-care more than anything. This isn't just about taking a bath or really indulging in ice cream or taking yourself to get a massage. You know, self-care encompasses a little more than all these important, but really emotionally grounding yourself to be able to handle the mental stress that will come tomorrow and throughout the week, whether that's speaking with a therapist or having your work assignments in order, or boundaries, creating those boundaries with family members and friends. So those are some of the tips I provide that have been shown to be very helpful for some of the clients that are dealing with those mental health conditions.
I appreciate that perspective, Kristen. We're going to get to agoraphobia specifically in just a second, but extroversion, social distancing. Sheree, do you have any comments about that in addition to what Kristen shared?
Yeah, no, I'm definitely an extrovert, and I love a good gathering. So this was initially very hard on me as well. But I just like to encourage people to think outside of the box and reimagine what your life is now. When the pandemic first started, we were thinking, what can we do temporarily to get through? But we're kind of in the long haul at this point. So definitely substituting some of those in-person gatherings that you would have with Zoom calls, or looking at other modalities that are free ways to connect. A lot of the social media platforms have ways of connecting in groups or watching movies together. Even Netflix has a modality to invite people to watch a movie at the same exact time, so that you can share commentary and connect in that way. So things may not be exactly the same, but looking outside of the box to find new and interesting ways to connect to people. Call people on the phone, good old-fashioned phone calls still work, having conversations, checking in on people. It may take a little more of you doing something in a different way to kind of meet some of those same types of needs. And I definitely agree with having a routine, especially if your kids are home doing distance learning. They should have a distance learning space. They should get up and get dressed and brush their teeth and shower and do their hair, all those normal things you would do to get your day going, and have a routine where this is the classroom, but when you're in your room, now you're chilling and watching TV. But you shouldn't do both, because the lines get blurry, or it's easy to stay in bed all day. So I think it's just mindful to to reimagine your life and those things that make you happy, and approach them in a different way.
I think that's profound thoughts as well, Sheree. I joked with you earlier about this shirt and tie. I did it for you, but I think of my days that way. I get up and get dressed, not always like this, but I get up and get dressed as if I was going to the office like I used to. Because Christian, I'd be one of those people that would sleep until noon if I didn't do things like that. So appreciate those comments.